कोविड-19 ने जहां हमें मुश्किलों और नई परिस्थितियों में भी सफल होना सिखाया, वहीं नई अपॉर्चुनिटीज भी दी हैं। To give us insights into the opportunities and challenges on the world's largest COVID-19 immunization program, we have with us today Dr. R.S. Sharma, who is the CEO, National Health Authority, Government of India, and Mr. Chetan Krishnaswamy, Vice President, Public Policy, Amazon India.
Ladies and gentlemen, I have the honor and privilege of welcoming Mr. Ram Sevak Sharma to this edition of Smbhav 2021, Amazon's annual confluence of innovators, entrepreneurs, and leaders from the Indian government. Welcome, sir. Mr. Sharma is a multifaceted stalwart as the CEO of the National Health Authority of India, which administers the Ayushman Bharat Yojana Health Protection Scheme. He is now tasked with the national effort of providing COVID-19 vaccines to the Indian population through the CoWIN platform. To Mr. Sharma goes the credit of creating the Aadhaar, India's biometric ID, which over 1.25 billion Indians have enrolled into. To date, the Aadhaar has completed 42 billion authentications and carried out upwards of 8.2 billion KYCs, which is simply phenomenal. Before joining the IAS in 1978, Mr. Sharma was a student of mathematics in IIT Kanpur. The young Ram was fascinated with the IIT's mainframe computer with its ever-blinking lights and automatic readers that swallowed cards. He puts this very beautifully in his book, The Making of Aadhaar, which was released just a short while ago. But then the passion endured, and in due course, the bright youngster found himself in the University of California studying computer science. Let me very quickly end this introduction by quoting the eloquent Nandan Nilekani, the first chairman of UIDAI, and someone who worked closely with Mr. Sharma on creating the Aadhaar. So he describes Mr. Sharma as a career mandarin with a disregard for convention, a versatile administrator in an obsessive relationship with code, and a tough taskmaster with a profound empathy for the human condition. So that very aptly sums up Mr. Sharma's personality. So we get on to the conversation now. And the first question that I have for you, Mr. Sharma, is you're one of those rare individuals who not only has tremendous insights into the capabilities and potential of technology, but also someone who is aware of the limitations and realities of governance in a country like ours. So how do you reconcile or harmonize both these sensibilities? Are you at conflict at times?
Well, thank you, Chetan. I think thank you very much for a very, very generous introduction which you provided. And I think the question also which you have asked is extremely pertinent. On the one hand, you have technology, which actually assumes a certain amount of literacy and a certain amount of, assumes that there will be complexities in using the technology. On the other hand, you have an extremely diverse country where illiteracy levels are also very high. Functional literacy is very high. People have certain sort of problems in accessing technology, and therefore again too many languages, also diversities in all kinds, diversity in infrastructure. There are places where you don't have connectivity. So essentially the question is, how do you make technology work? Number one. Number two, some people say, look, technology will not solve any problems in this country, because problems of country can be solved usual connects with the people, you connect with the people, and you take your administration to the people's doorstep, etc., etc. That's the other logic which people give. My, sort of conviction, and it has grown from being a sub-regional officer in a part of Bihar, remote area of Bihar called Godda, to the chief secretary of Jharkhand, and then of course UIDAI, and then TRAI, and overall I have about 42 years, 43 years I have worked in the government, and my conviction has grown to this point that, look, if you make technology accessible, people do adopt technology. People do, people in this country, have been making missed calls, for example. Missed calls
Right.
is such an innovation which only this country had. Nobody had the missed call part. And they avoided the sort of high rates, and they used technology. So people can use technology. Today you have 1.2 billion phones in this country. You have 700 million smartphones, and those are possible only because people are able to use technology. And I have seen in my village, my own village, people remember many 10-digit numbers, mobile numbers. There is setis, bare, pandre. This is how they remember the numbers. And people sometimes make even they make their own symbols on the phone. If they are illiterate, then they can say, this symbol will be in that person, and this symbol will be in that person. So people do find out ways to use technology, provided you make technology simple. That's number one. Number two, I've also realized that this personal contact and the personal kind of approach to administration, many times actually it distorts itself, and it creates huge amount of rent seeking. So it's better if you make the information more democratic, and if you remove the information asymmetry, that's the best way. And you sort of disintermediate this human element, then in most of the situations it works much better. For example, today you can get your revenue records on the computer, through any common service center. 5 years back, if you wanted to get your own revenue records, you will have to run around a patwari or a any other village level revenue official, whatever they are called. So actually, karmachari or patwari. So actually, there are there are many areas in which technology can work. And I also, like Nandan Nilekani, I also am a firm believer now that technology can solve most of India's hard problems, which cannot be solved otherwise, because the numbers are so large, the situations are so diverse, and that will basically mean that if you use technology which is scalable, which is speedy, which is frugal, which is interoperable, which has all kinds of attributes to basically go to the population scale, then you can solve these problems. And I think we have demonstrated, India has demonstrated by creating many such products. Aadhaar is one of them, UPI is another product, and of course we have built too many, as you just alluded, electronic KYC, 8.2 billion. We have made DigiLocker is now storing, it's basically the private space on a public cloud, so to say. So all these things have come, and people are using it. So while I do agree that there is what is called a digital divide, at the same time I think more and more people are using technology, and it is coming to the aid of the people. And of course, vaccination drive is one latest example.
Yeah. No, absolutely. And the COVID platform is essentially the fulcrum, around which the largest vaccination drive against the virus is sort of happening, right? And the question that I had for you is, what are some of the key principles that you need to keep in mind while building population scale digital infrastructure in a country which has such wide economic disparities?
Wonderful question. Thank you very much again, Chetan. I think I believe that there are certain attributes which are essential for development of digital public digital utilities for a country like India. One is that it has to be scalable. Obviously, the numbers are very large. Second is it has to be very speedy, which means that you can't, for example, if one made Aadhaar and one was making only about 2 million Aadhaar per day, even then it will 200,000 Aadhaar per day, then it will take 20 years to make Aadhaar. And by the time you made Aadhaar for a first person, he would have died. So basically, it has to be a speed. Speed is another very important attribute of any technology solution for India. Thirdly, and most importantly, India is an extremely price sensitive market. So, for example, if you make a digital money transfer solution, so if you want to transfer money through Western Union, you pay still some a few dollars. Now, if you think that if you make a digital solution for India where you transfer money, and if you say 2% will be eaten by this digital artifact, nobody is going to use that thing. So it has to be frugal. It has to be absolutely cost effective. Then and only then people will use it. When we were having 8.48 rupees 40 paisa as the per minute charge in telephone, there were only a few million people. And today, when you are having more or less free, people are talking and talking, and you are talking 600 minutes per user per month. That's the average from 300 some a couple of years back. So basically, because India is an extremely price sensitive market, you have to have frugal solutions. That's another part. Fourth attribute, I think, is interoperability. Basically, you can't create silo solutions and then they will not talk to each other. So basically, and you have to have an interoperable solution, and then and only then you can build larger products. For example, we created Aadhaar. Now, Aadhaar is one digital public utility, and we make digital identity using Aadhaar, and that can plug into any transaction scenario. So you can use Aadhaar to open a bank account. You can use Aadhaar to get your ration in subsidized rates. You can use Aadhaar to get your LPG connection, and you can do many things. You can get your Aadhaar to do let's say mobile SIM. So it has to be interoperable. It has to be pluggable and interoperable. And I think it should also be modular in its approach, which is a no-brainer. Every software is now modular. It has to be cost effective. Once you build that infrastructure cannot be very costly, because our country cannot afford to have such great investment. So, for example, just to give you an example, the UK's ID card, which was proposed, that ID card is 135 pounds per ID. That was the estimate which London School of Economics came out with. Now, we made Aadhaar, which is just less than 100 rupees per Aadhaar, which is just £1 US pound, British pound per Aadhaar. So 135 pound versus £1. So that's we made the entire infra of Aadhaar at the age of just about $1.5 billion. Now, $1.5 billion investment is saving, $15 billion per annum. 91,000 crores is what the then finance minister Arun Jaitley told him in Parliament, before Parliament. So I think this is another part. It has to be cost effective. So, and then of course it has to be inclusive. Inclusivity is extremely important. What does inclusivity require? It requires ease of use. People should not find it frightening or terrible. I can't use this infra. So it should be very easy to use. So inclusion is another part. Otherwise, you will create more digital divide. So some of these basic principles which are required, maybe there are some more and I'm not able to recount them immediately, but I think the most important ones are frugal, cost-effective, inclusive, interoperable, speedy, scalable. These are some of the attributes which any system will require. Similarly, talk of CoWIN. Now, CoWIN also, it should be simple to use. It's very inclusive in the sense that you just have to have your mobile number and you plug in your mobile number and OTP comes and then you are good to go. You open it, your account becomes visible to you, and then it has to be easy, because suppose everybody doesn't have a mobile number, everybody doesn't have a smartphone. So we created a situation where one mobile number, you can have 4 people registered against that mobile number.
Right.
Then of course it should be easy to schedule appointments. You can reschedule appointments, and those 4 people should not be tagged as one. They are not one passenger. They are 4 passengers. Yeah. The 4 passengers, obviously, you can separately put them in different trains. So basically, they can go to different places on different dates for vaccination. So this way, I think we have unbundled. Unbundling is another part which I think is very important in a software, because generally in the West they have made monolithic solutions, and that I think now we have an APIification, in the sense that one can loosely connect these components to APIs, And that is actually another attribute which the software must have. So I think these are some of the principles with which every software at a large scale, when you build it. For example, UPI is nothing but a set of protocols.
Right.
And now enable any bank to any bank, any mobile wallet to any mobile wallet, and everything is done. Yes, I think.
Right.
Hopefully it answers your
Absolutely.
question.
No, that's a great response. Uh, the other question that I had is, you mentioned the need for these platforms to be robust, scalable, extremely reliable, and more than anything else, they obviously need to be a platform without proprietary components for very obvious reasons. What is the potential that some of these open source tools hold for, again, deploying country scale healthcare delivery? Considering that you are going to be at the center of it all in the coming days, how would these platforms now really scale the healthcare situation in our country?
Again, Chetan, of course, you always ask very, very pertinent and important questions. And this is also an extremely important question. So one is, I must mention to you that as a matter of policy, about 5 years back, we created a couple of policy, documents. And a triad of policy document was basically a policy on open source, policy on open API, and policy on open standards. And actually, I forgot to talk about one of the attributes of the software in India should be open standards. It should be based on open standards. Only then it will be able to connect with other softwares or components. So I think these are the again 3 basic issues. And we believe, and we believed in UIDAI, and then of course I have continued to believe that open source is a first choice. But then open source is not a part of an ideological choice, put it this way.
Mhm.
Open source is actually, for very pragmatic reasons, open source is our preference, because open source, the total cost of ownership and other kinds of things also, it is basically open to the public. People can make contributions, and it's crowdsourcing in some sense of the term. So that's one of the reasons for open source. But if there are no products of open source product available in a particular area, we have no problem in deploying the proprietary softwares as well. For example, UIDAI, we have deployed the biometric solution providers as the proprietary solutions, because we realized that in biometric deduplication, the software which are scalable existed at that point in time.
Right.
So therefore, we are not saying that if you don't have any product, you should not not have any proprietary software. That's not our approach. Our approach is
Right.
that let's look for a product which is open source, if it's available, use that. If not, you can use the other part. Of course, you should also see that there are many open source which may not be scalable, which may not be the ones which are working at that population scale. So obviously one has to make a selection, and one has to make its choices. My other part is that many things can be outsourced, but the thinking should not be outsourced. And
Right.
this is we should have the strategic control on thinking, and strategic control on many of the components or things which we make for the government. And
Right.
that is another part. There are many things, and we should have the wisdom to basically differentiate between the two, which is basically what to outsource and what to have a control on. So that's my broad thinking on this issue.
No, absolutely. That's an interesting philosophy. And, it also brings me to a very pertinent question in terms of what role do you envisage for the private sector at this juncture? When there is a need for the government to, augment its efforts and as much as possible rely on, partners to really, disseminate the vaccination program far and wide into the countryside. So is there any, what specific role do you see, and what steps would you be taking in the coming days to really rope in the private sector, sir?
Again, thank you very much, Chetan. This is also a very important question. In fact, I have been, since the time I have come into this program, I have been one of the proponents who has been saying that unless we rope in private sector in a very significant way, we will not be able to scale up this program. And ultimately, private sector is an equal partner in this whole process. And our Prime Minister also, if you recollect, he has been talking about involving volunteers, involving civil society organizations, involving private organizations, NGOs, etc., in this whole drive. So one is involving them as active partners into this process, which is basically what we have done, is that all the private sector hospitals, Ayushman Bharat, CGHS, and any other hospital which the state government wants, they should also be roped in for vaccination. And they are playing an extremely important role. And in fact, we want them to play more and more active role into the vaccination program. So that's one part I see. Second is on the other part also, the COVID software, for example, has got four major components. One is the registration and appointment component. Another is the vaccination component, where you verify the person who has come for vaccination and record the vaccination event. Another is the private hospitals have to create their timetables and their how many vaccinations they will do on what dates, what are their holidays, so their calendars, the calendar of events. So that is also a part of the COVID software. And the last part is basically issuing the digitally verifiable certificate. That's another part, which is basically we are aligning it with the WHO standard of the FHIR, as they say, fast health interoperable resources kind of thing. So these are the four components, and we consider that the certification will remain with the government, with the COVID system, but the rest three parts can always they are all API, they are connected through APIs, and they are open APIs published. Therefore, at some point in future, we might decide that no, hospitals can have their own appointment system, no problems. Hospitals can have their own vaccination system, so long as they give us the information on real-time basis. We will be fine with issuing the certificates. So this is the broad, going forward, and that is why from the beginning itself we have made it API-based system, so that any component can be, we will say that okay, now we don't need to really own this component, and other people can also come in. So that's the roadmap I see. I also see that in my own area in which I am working, the National Health Authority, private sector is actually the major role is being played by private sector. For example, the Ayushman Bharat program of insurance, that itself is being done by insurance companies, private sector hospitals, and all other people are also private sector people. Similarly, the more importantly, the National Digital Health Mission, conceived and launched by the Honorable Prime Minister on 15th of August last year, that also actually talks about creating an interoperable, inclusive digital health platform, where private sector will play the entire role. All the service providers will be private sector. All the people who are going to benefit out of this are going to be private sector. This is going to be an open, interoperable platform, which is going to be inclusive in the sense that, and therefore it has to work on some different principles. And just to give you an idea, we are going at the base layer will be the common digital infrastructure, which is like identity, consent, digital certification, electronic KYC, payments. Right. This will be the overall, horizontal kind of digital infra. And then, of course, in the middle layer, you will have the health, professional registry. You will have the lab registry. You will have the the verifiers and service providers, these kinds of fellows, doctors registry. And on the top of it, you will have the consumer-facing applications, which will access this middle layer using the the base layer for various kinds of activities. So that's the broad architecture of the National Digital Health Mission, and we are going to obviously consult with the private sector in a very, very extensive manner on each of the issues, so that it becomes a win-win for all.
Yeah. No, one fantastic innovation has been the issuance of digital certificates, which again is unique to India in many ways. How do you see this becoming increasingly relevant as the world goes by, right? So the virus stay on quite some time. People will travel across the world. There's no stopping that. So what role will the certificate, the digital certificate, actually play in the coming months and years, Mr. Sharma?
We actually envisage that digital certificate will become an extremely important sort of certificate, in the sense that many, sort of airlines will say, maybe after a couple of months, saying that we will, require a person who has been vaccinated, finally vaccinated with 2 doses of vaccine. And as
Right.
you know, we are issuing a provisional certificate after the first dose, and we are issuing a final certificate after the second dose. So
Mhm.
it will become a very important travel document. And once we align it with the international standards, as I explained to you, WHO standards,
Right.
then, it will become an it will become a certificate which will be valid throughout the world, and you can do that. Secondly, you can store it on your device, and you can get it downloaded, and because it is verifiable, so it is basically temper proof, and it's also forgery proof certificate. And that becomes a very, very important artifact in this digital world. You don't need to carry any paper, which actually is usually non-verifiable. So you have much better confidence in a digital artifact which is verifiable. So that's what I see as. So please remember that this is going to be the first document in a public health record, in a person's health records. So basically, we want to have in the National Digital Health Mission the capability for a person to have his longitudinal health records stored on the health locker, or a digital locker, or on mobile, or whatever mechanism of storing it he wants. And then he should be able to, using the digital consent token which we have developed and which we notified way back in 2014, he will be able to give consent to a doctor to see his or her digital records. So this will basically become a very, very massively scalable platform, which will also ensure that the patient remains in control of his or her records, and he is able to provide that consent in a hassle-free manner, so that the doctor to whom he is going to see is able to easily have access to his digital records, his or her digital records. So that will become an extremely powerful enabler for getting digital health services. And we believe that many of these services, of course, there are certain services which cannot be given digitally, but many of the things, for example, consulting the doctor, your doctor might say, okay, first time you have come physically, next time onwards, I'll only have, come over video, and I'll be able to provide you advice, diagnostics, laboratories, many things will probably, and it will actually include, it will also reduce the expenditure for the patients. It will make things more traceable. It will make
Mhm.
things more accountable. So the digital, digital, as you are a man of digital world, friend. So
Mhm.
you know that how digital processes are much more robust and much more accountable and
Right.
much more traceable. And that will be the added benefits of National Digital Health Mission.
Sure. Sure. So my last question is on the Ayushman Bharat Pradhan Mantri Jan Ayogya Yojana, which is easily one of the biggest health insurance schemes of the central government aimed at achieving universal health coverage. And in the last 2 years, it has made quite a bit of strides. The scheme has transformed and quite a bit and provided free healthcare services to vulnerable citizens and touched the lives of over 1.76 crore beneficiaries already. And we hear that the target is around 55 crores. Uh, so what are the challenges that you might have to really surmount, uh, to hit that 55 crore beneficiary mark uh, in the coming years?
Well, thank you. I think this is also an extremely relevant question which you have posed. So let me sort of break down these challenges into a couple of areas. One is actually the demand challenge, which means that as of now we have been able to identify only about 15 crore people, to put it this way, 15 crore individuals. Now the total number which are eligible to be included in Ayushman Bharat is of the order of 54, 55 crores. Now, the challenge with us is that these 54 or 55 crore people are those people whose names are included in something called SECC, which is Socioeconomic Caste Census data of 2011. Now, what has happened is that they are eligible, but they do not know that they are eligible. So basically, to kind of solve that problem, our job is to figure, to read that name from that list and to attach it to an individual, because that list does not have, there was no Aadhaar at that time and it was not linked to Aadhaar. So basically, we do not know who that individual is. So, for example, you might find that Ram Sevak Sharma is one person, but then Ram Sevak Sharma is me or some other namesake of mine. We do not know. So this is basically one job where, estimating that Ram Sevak Sharma, son of Mr. Y and resident of this and that, whether he corresponds to the individual who figures, let's say, in some other database, is the same individual or not. So then if he's the same individual, then I have to give him some token to say that you are authorized, you are basically eligible, because then and only then he will know that he's eligible. So one of the problem which I think we are trying to solve through technology, and probably we will, reach out to you also as to how we can, solve that problem. And I'm thinking of using crowdsourcing. I'm thinking of using, many, people can point out, yes, this is the person and these two persons in these two databases are same person.
Right.
Then we'll be able to provide that. So one is this challenge which we are facing. And this challenge, immediately after I joined this organization on 1st of February, I took up this challenge and I said, let's accelerate that process. And we actually accelerated the process, and we have, in the last 1 month, we have done 1.5 crore identification of people. 1.5 crore people have been identified, and they are being issued some, plastic cards, PVC cards, so they are durable and they know and they can go to the hospital. So this is one problem. Of course, it's also very important, because unless you identify these people,
right,
and unless you give them some token, these poor people don't have the courage and the, because if they go to the hospital saying that I am Ayushman Bharat beneficiary, they'll say, show me your card, show me your, what is the proof that you are Ayushman Bharat person? So essentially, we have to empower them through this digital, this token. That's number one. And of course, this token is verifiable from the back end, because we will have online connectivity. We will have a QR code on this token, and you can read the QR code and you can just see that this particular token is genuine or not. That's one part. Second is the supply side problem. So what is happening? There are many districts in which the health facilities are not there. There is a dearth of health facilities. So how do you solve that? So we want more and more sort of health facilities to get empaneled with us, join the Ayushman Bharat, and then sort of provide services. There are other concerns also, which is basically the rates. Now people say that the rates of Ayushman Bharat packages are very low. Now obviously there may be some merit in that argument, but also the argument that maybe the package rates are lower, depending on whom you are looking. If you are looking for Vedanta, they may be lower, but for other hospital in some remote rural areas of Bihar, they may not be so low. So that's another problem, but we will try to solve that problem. We also are making out a case saying that yes, they may be low, but looking at the low rates can be compensated by high volumes. If you have high volume of transactions, then obviously the low rates also become viable and workable. So that's another part which we will solve. So there are multiple, sort of points which we have to attack, and we have to ensure that our 50, because there can't be any more pious work than what it is. You are, believe me, and you know it very well, that for a lower middle class family, if there is some sickness in the family and this is not less than a catastrophe. People get into that trap, and people just, their lives are ruined if they are not able to, if they are faced with such kind of health catastrophe. And I think we can ameliorate their conditions. And that I think is very, very important. So therefore, for us, it is very important that the sooner we cover our entire, people, the 54 crore people, the better it is, because then we will be able to provide them the care which they deserve, and this certainly the Prime Minister's vision of having an Ayushman and wellness vision can be sort of realized.
Thanks for giving us a snapshot of your work and the sort of range of activities that your organization undertakes. And thanks for taking the time to be part of Amazon Smbhav, sir. We truly value your perspectives. And also, more importantly, thank you for stepping in and leading this fight against the pandemic, right? Clearly, history will remember you once again. Aadhaar, I think, is a good enough sort of benchmark. But this is something that impacts and affects all of us. And we are with you in this sort of fight against the pandemic.
Thank you, Chetan, for having me. I really enjoyed the questions, your questions, and the conversation. And thank you for wishing me good luck. Thank you.
And to our audience, thank you for joining in. And we hope you have found the last few days of the summit enriching and fruitful. Enjoy the rest of the sessions.
İki hasret cana